Hi, this is a brief talk on teen mental health since it's Mental Health Awareness Month. We do this as part of our Walk with the Doc program. So just a little background. It's fairly common to have children. We'll talk mainly about teens between the ages of 13 and 19, since it's fairly common to see children suffer significant illnesses and not get access to care. So it would be helpful for us to understand this population and get early treatment for these children. Mostly anxiety and depression are fairly common. At least 5 to 10% of children will say that they are struggling with some form of anxiety or depression. 50% of the children would say that they have had periods but may not have lasted more than 2 weeks at a time. The risk really is this becoming a serious mental illness and affecting their wishes to stay alive, and sometimes this will lead on to suicidal behaviors or then actually suicidal acts. So mostly we want to be able to identify children with mental illness because we want to prevent what is considered a serious illness. The other thing we're trying to also find is sometimes children come to the clinic with ADHD, and that sometimes is a gateway to treatment. A lot of children, especially boys, will be referred to mental health providers because they're disruptive in class, or mostly because they are hyperactive. Girls tend to get missed because they tend to be more on the inattentive side. But either way, when we have children with attention deficit disorders being asked to be evaluated, there is a comorbidity of both depression and anxiety in that population. So it is good to be able to evaluate for this as well. The other serious illness in children is trauma. This is frequently missed, and this can present as post-traumatic stress disorder. It can lead on to substance abuse, which can also be triggered by family history, especially boys and men. If they have a history of male genetics, is much more common. And frequently now we see many children trying other kinds of drugs as well. Cannabis is sort of the gateway drug after cigarettes. So early diagnosis is important. So we want to keep an eye on children, whether it's in our school settings, whether it's in our neighborhoods, in families, or in church groups or volunteer groups. So this way everyone has some idea of what's going on with the children in their lives, and not leave it just up to parents to be able to look for these symptoms and also be aware of what could be done if they notice something. There's a lot of shame still in saying that you have a child with a problem. And so stigma is still a big concern. So the more families are able to share that they have had a family member or they themselves have sought help and asked for help, then children are more willing to listen and share their symptoms with parents. One of the stressors which prevents a lot of children coming to their parents is just harsh parenting. So if parents are extremely judgmental or avoidant or do not like talking about stressors in a child's life, then they definitely get missed till later in their years, where they come for help. Peer pressure is another thing that leads to a lot of stress in children, leading to social anxiety, avoidance behaviors, use of substances. Media influence has become more prevalent in the last 10 years. Academic stressors in some families where high achievement is the goal. Of course, hormonal imbalance is universal. All children go through mood changes, but they last very short periods and they should get better on its own and really not have any chronic mental illness because of this, but it can trigger anxiety or depression. Parental separation, changes in the family dynamics, loss of a family member, socioeconomic changes, bullying in school, abuse at home, which can be more severe, physical, emotional, or at times sexual, either at home or by neighbors, parents, family members. And also moving. Sometimes children who have been used to a particular school system have a hard time accepting changes and making new friends in a new situation. So this can also be pretty difficult for them. So when children are moving, you want to keep a close eye on them and see if they've made connections with new people in their school or they're still very avoidant. Obviously, genetics is a concern. In a few families, there is serious mental illness, bipolar illness, alcohol, OCD, do run in families. So when parents have these illnesses, they will be taught to keep an eye on their children's symptoms early teen, late teen years. Of all the risks we have, suicide is the one we want to prevent the most. Attempts are more common in girls, and completed attempts more common actually in boys. Use of firearms is the number one risk factor. So access to firearms really has to be carefully thought about in any family member that has a child that may have some mood issues or behavior issues. It is considered to be either the second or third leading cause of death. Of course, this changes year by year, but still it is one of the top concerns we have. Other diagnoses we see in children are OCD, which is easily treated, eating disorders, both in boys and girls, and more serious illnesses are schizophrenia, bipolar disorder. We won't get into those. Autism spectrum disorder is caught early on, so we really have very few cases lingering in late teens. By early childhood, most parents are able to look for these symptoms, so they do get diagnosed much earlier. Again, for the diagnosis, we do have a full psychiatric evaluation if they can get one. Otherwise, scales can be administered by the pediatrician, school psychologists, school nurses, teachers at times. So mental health screenings can be done at least for anxiety and depression fairly quickly. And the risk of suicide we should always ask about that. And there is no harm in asking about it. It does not trigger behavior. Once you have a diagnosis, you want to get immediate access to care. Crisis lines are always available. The entire country now uses 988. Similar to 911, so all facilities, programs, schools have access to care, so that should be utilized very quickly if someone is screened in for suicidal thoughts. Also, sometimes you may pick up in children with anxiety or depression, childhood disabilities that have not been picked up. Could be learning disabilities, speech difficulties, stuttering. Also common now is depression and suicide risk in LGBTQ population. So these are special populations in which you have to be more careful and not miss that because they will not come to you for help. So treatment, of course, the first thing I'm going to say is suicide risk and prevention. So access to firearms should always be limited. Gun locks are available in most first responders offices, whether it's the police or the fire station, or through your mental health provider or pediatrician's office. Access to opioids in the home. If parents or grandparents have access to opioids, these need to be in a lockbox. Early teens do look for medications that might be available. They may not use it themselves, they may share it with others, especially peers ask about medications available in the home. So treatment is fairly effective. Medications can be used for depression, and we have FDA-approved medications, fluoxetine and escitalopram. Both are considered SSRIs. Therapy and medications are equally effective. So if families choose therapy, 60 to 70% of the population will get better with therapy or with medications. So you can pick one or the other. Generally better to have both together. So if you have individual therapy and a child is able to tolerate that, that would be effective. If not, family therapy along with medications would be more beneficial, and you can get 80% improvement. Now we also have RTMS, which is approved, FDA approved for ages 14 to 19. Again, family therapy is extremely important, especially if there have been changes in the family dynamics and if parents are willing to come together with the child. Individual therapy works better when they're late teens because they find there are many issues that they can discuss in the absence of parents. Frequently it's relationship issues, breakups, things like that. DBT is a very specialized treatment for children with suicidal behaviors, mostly cutting type behaviors, and it's dialectical behavior therapy, very specialized and very, very effective. It's about a year long, done on a weekly session with the therapist itself. Various resources are available. The American Academy of Child and Adolescent Psychiatry has a very good website. It's always good to go in there and review the current recommendations and up-to-date information on treatments available. Flyers might be available if you need to share it with your community. If you're doing a mental health screening, always best to use that website and then try to get information from there. It's very important to address the stigma in your community, within your family, within close friends groups. Community supports are extremely available, easily available, even if your immediate family or friend circle is not available. Do use the community mental health resources. Also have children involved in all different kinds of activities. Both the family, friend circle are important, but also religious groups, volunteer activities, neighborhoods, community supports. This way there's a wide circle of people involved in a child's care. It's almost better to think of raising children in a village model rather than thinking of raising children just by individual families. The more isolated a family group is, they may tend to miss on their child's behaviors. Mostly these behaviors or symptoms exhibit not only in the parent's home, but also in a social setting as well as in the school setting or later on in the work setting. So depression is fairly common, and you will notice children will be either sad, moody, or irritable, or they may not be eating right or sleeping right, or friends may notice that they're more isolating, not sharing information with them. So different people notice different things, so it's always important to see how these symptoms can be picked up by various people. So having a wide net of resources is actually quite helpful. Anxiety is definitely quite evident in the home because there is social anxiety. Children avoid going out and they are comfortable only in a small circle. But also sometimes it is evident when they have public speaking in school, and so teachers notice it more than families at home. So in different scenarios, you can actually pick up on these symptoms and see it differently, presenting differently. So having different resources, different people who are aware of mental illness is also very helpful, and gently nudging the family members or the child, if they are part of the child's life, to talk about it with someone they trust is extremely important, and to not avoid talking about it is unfortunately the biggest risk factor for this to be untreated, which is fairly easy to treat, and fairly effective treatments are now available. I hope this is helpful, and please let us know if you have any questions and we can answer them later. Thank you.